for a lot of students, coming to student counseling may be their first experience with medicines, and so they may not kind of know how it works. For ongoing medication management, we can typically provide that for students the entire time they're enrolled, so maybe for several years. That would involve, as a first step, an initial comprehensive evaluation with one of the psychiatric providers. And then if medication is indicated and the student agrees, then a prescription may be offered. It's always the student's choice whether they want to go on a recommended medicine or not. Prescriptions are typically sent electronically to whatever local pharmacy a student prefers. Most students do use their insurance to help pay for prescriptions as well. Our psychiatric staff will want to follow up with students regularly. That's often more frequent when they're initially starting on a medicine, but less frequent if it's working out well and things are pretty stable. If a student's going to be running out of a medication, it is their responsibility to let us know ahead of time. There is a turnaround time for prescriptions, ideally a week before you're going to run out of a medicine. Let us know directly, not through the pharmacy, but contacting us directly. I think the second important thing to note is for students who are coming to the university and are already taking a medication, it's always good to be proactive. Try to set up an initial appointment if you'd like to have your medicine monitored at student counseling early on, and make sure that you have an adequate supply of your medicine with your previous prescriber, because there is some wait time to get in. Students will then, typically the prescriptions are sent electronically to one of the local pharmacies, and most students will use their health insurance to help pay for prescriptions. While the eligibility for sessions is covered for students, paying for prescriptions has to be done through insurance. And then our providers will want to follow up with students as regularly as needed to see how they're responding to the medication. That may be a little more frequently initially sometimes, but then can be pretty infrequent if a student's on a stable medication regimen. I think I would just want to emphasize that student counseling here at the University of Chicago does provide comprehensive ongoing psychiatric care for students. It's convenient. It's free for eligible students, and if it's appropriate, I would encourage students to take advantage of that and come see us.